Drug addiction is a dependence on illegal drugs or medication. When you're addicted, you may not be able to control your drug use or may continue using drugs despite on the harm it causes. Drug addiction can cause an intense craving of drugs and may want to quit, but some people find a way that they can't do it on their own. For many people, what starts the casual use that leads to drug addictions. Drug addictions can cause serious long-term consequences, including problems with physical, mental health, and relationships, employment, and in the law. The symptoms of drug addiction is feeling that you have to use drugs regularly. This can be daily or even several times a day. Failing in your attempts to stop using drugs, making certain that you maintain a supply of drugs, spending money on drugs even though you can't afford it, doing things that obtain the drugs that you normally wouldn't do, such as stealing, feeling that you need the drugs to deal with your problems, driving or other risky activities when you're under the influence of the drugs, focusing more and more time and energy in getting and using the drugs.
Risk factors. People of any age, sex, or economic status can become addicted to a drug. However, certain factors can affect the likelihood of your developing an addiction. Family history of addiction. Drug addiction is more common in some families and likely involves the effects of many genes. If you have a blood relative such as a parent or sibling with alcohol or drug problems, you're at greater risk of developing a drug addiction. Being male. Men are twice as likely to have problems with drugs. Having another psychological problem. If you have a psychological problem, such as depression, attention deficit, hyperactivity disorder, or post-traumatic stress disorder, you're more likely to become dependent on drugs. Peer pressure. Particularly for young people, peer pressure is a strong factor in starting to use and abuse drugs. Lack of family involvement. A lack of attachment with your parents may increase the risk of addiction, as can lack of parental supervision. Anxiety, depression, and loneliness. Using drugs can become a way of coping with these painful psychological feelings. Taking a highly addictive drug. Some drugs, such as heroin and cocaine, cause addiction faster than do others.
Okay, hello. So for a study done by Siri Carpenter, she wrote a research conducted by Dr. Stephen Grant on cognition essential to drug addiction. And this pharmacological studies have long supported that view, showing that drugs abuse powerfully affect the brain dopamine system, which regulates emotion responses and plays a part of abuse by providing an emotional reward for continued use. Brain imaging studies in humans and neuropsychology studies in non-humans have shown that repeated drug use causes disruptions in the brain highly evolved the prefrontal cortex, which regulates cognitive activities such as decision-making, response inhibition, planning, and memory. Since the 1980s, scientists have observed that many people who are addicted to drugs such as cocaine and marijuana appear to have frontal cortex abnormalities. Such abnormalities, however, were long thought to be incidental side effects of drug abuse. In the past 5 years, however, the tide has begun to turn. At a 1992 scientific conference, Dr. Antoine Bechara described research showing that patients with frontal cortex damage had impaired decision-making abilities reflected in their performance on a laboratory gambling test. Grant saw Bechara's presentation and made a connection to drug abuse, hypothesizing that disruptions in the frontal cortex might be responsible for impaired decision-making and behavioral inhibition in drug abusers, and that could help explain that compulsive drug seeking that is a hallmark of addiction. Using Bechara's gambling test, Grant and his colleagues tested drug abusers' decision-making abilities. Last year, they reported in the journal Neuropsychological that drug abusers indeed make poor decisions on gambling tests and did participants in control groups. More recently, Bachar and his colleagues uncovered 3 subgroups of drug abusers. About 1/3 they showed no decision-making impairment on the gambling test. About 25%, in contrast, responded exactly as patients with frontal lobe damage have shown to do, almost invariably choosing a higher immediate reward, even knowing that their strategy will be unprofitable in the long run. Finally, about 40% of Bechara's study participants appear to be hypersensitive to potential reward, no matter whether they were immediate or long-term. Bechara argues for drug users who are sensitive to both the short and long-term consequences of drug use. Heightened awareness of the negative long-term consequence of abuse may be sufficient to tip the scales and help quit using drugs. Classically, people thought that drug addiction was a disease that involved the centers of pleasure, that people are taking the drug because it's pleasurable. In another research, Dr. Nora Volwak stated that, but that's not the case. In fact, addicted people don't have as strong a pleasure response as people who aren't addicted. Recent data are showing us that addiction entails a basic disruption of motivational circuits. Thank you.